Hi, I'm Lynn Leggett, founder and CEO of Victory Dental Management, and welcome to another Coach's Corner. Today, I'd like to talk to you about reopening your practice, or maybe if you're preparing to open. Some states still have not opened yet. So what I wanted to share with you is you may need to, in these times, rethink how you did dentistry before you had to close. So by that I mean there are some practices where some team members either elected not to come back or they decided to go to other practices. Whatever the case may be, some practices are there with different team members, and maybe there's holes in the team currently. So you're not alone. If that's what's happening to you, let me just say right now, you are not alone, because that is happening across the country. So with that in mind, I want to encourage you with a question. And the question is this: what if you were able to create a new way of doing dentistry in your practice? What would that look like for you? And I ask that question so that you can start to think outside the box. Because maybe due to some lack of PPE or a team member like a hygienist coming back to the practice, you're having to rethink how are you going to take care of your patients and your patient load that needs to be seen and taken care of. So think creatively and think outside the box when it comes to your schedule. Maybe you can have more same-day dentistry than you had before. Maybe you start doing hygiene as the doctor, or you mix something like that up, because I'll share with you something that happened to a client of mine. The hygienist decided not to come back for several different reasons. So instead, he's currently looking for a hygienist, but right now he has to take care of his patients, right? So how can he think outside the box with his schedule to be able to take care of his patients? What he's decided to do is to be able to work his schedule on Monday and Wednesday mornings, and in the afternoon, see hygiene patients. And then on Tuesdays and Thursdays, switch that around. Now, there are a couple positive things that happen because of this. Number one is, with this particular practice, he's the only one that is clinically seeing patients. So he can take care of a myriad of things going on with them. So production actually is looking really good, which may surprise some of you. But he's tired, but things are looking really good. Plus, the added benefit, he's not using as much PPE. And some practices are still struggling with trying to find enough of that. So I don't want to alarm you, but these are some positive things that can come of changes with your team right now. It's also a good time to be creative with the insurance participation that you are choosing to have. With the COVID outbreak, COVID-19, it has forced a lot of practices to look at a lot of different things that maybe they were putting on the back burner, or they weren't sure how they wanted to handle that. Now, in my opinion, to be able to handle differences with insurance participation, you truly need to understand your financials and your profitability. You don't want to make a mistake and not take care of a majority of your patients, or not handle getting out of insurance contracts the wrong way, because there is a right way to do it. Again, insurance is part of your overall business plan. So if you look at it with that accordingly, then you can make some great decisions. So asking yourself what if can be really beneficial to you and your practice. And I know I covered a lot of things in a short amount of time, so please get in touch with me if you'd like to have a discussion regarding this. And I just want to let you know, it's not too late to take advantage of my program called Evolve. Even if you've reopened, it's not too late to take advantage of that, to make sure that you are doing the best job you and your team possibly can be, especially with all the changes that you may have in your practice. So, hope you're staying well, stay healthy. Till next time.